Okay, here we go again. Another COVID variant is starting to raise attention.
Yeah, it's causing a surge in cases, but how worried do we really need to be? Dr. Amesh Adalja with the Johns Hopkins University Center for Health Security is live with us. Good morning to you, doctor. This is known as Pirola. Is it just a mini wave, and how big of a deal is it?
Well, we don't really know what role this variant particularly is playing. There's been only a handful of cases. What's gotten people's attention, though, are the mutations that this has. This isn't the dominant version of the virus that's out there, but it is something that people are watching to see if it becomes the dominant version. So right now, it's something to watch, to try and understand, to see, is it more transmissible? Is it something that is going to displace the current EG5 variant that's causing illness? So it's really premature to know exactly what its trajectory or implications are.
How do the symptoms compare to the typical COVID variants that we've seen so far?
They're all the same. The symptoms are really indistinguishable. You cannot tell from symptoms which variant you may or may not have. So there's no way to really know unless it's done with kind of sophisticated sequencing, which is not done on most cases.
Do we know if the vaccines, especially the one that's coming out maybe next month or early October, will work against this variant?
Well, we're pretty certain that the vaccines, including the updated one, will work against what matters, meaning prevention of severe disease, hospitalization, and death. But because of the mutations that this variant has, it's unlikely, I think, that the new vaccines will be able to block infection. It's going to be a mismatch. But remember, the goal of the vaccines are not really to prevent infection at this stage in the age of Omicron. It's really about preventing severe disease. And I suspect we'll get good news when it comes to the ability of vaccines to do that if this becomes a dominant variant.
And as we take a look at COVID hospitalizations, we have seen that they have tripled in some cities, so certainly a concern there. But with that new COVID booster coming out, we have asked several doctors their feelings if they would suggest people wait to get that one versus getting a booster now. And they've actually all told us that they would want to consider people waiting. What is your suggestion?
I agree. I do think it's worth it to wait. It's only going to probably be a couple more weeks. Mid to late September is when the new booster should be out. And I think we want to get the best booster in our high-risk populations. And when you talk about hospitalizations tripling, I think it's important to remember the absolute number is still very low. It sounds scary when you see the percentage or people say triple, but remember, if hospitalizations go from 2 to 6, that's tripling, but it's not putting hospitals under strain.
That is so good to bring that awareness about. Thank you for that.
Yeah, let's talk about masks now. Texas is not going to bring back mask mandates. In fact, we have a new law going to effect tomorrow that will ban such a thing from happening. It'll just be a personal choice. Who do you recommend masks for right now?
I think masks are a tool that people can use, especially if they're high risk, if they're immunocompromised, if they're elderly, if they have heart and lung disease, if they're diabetic, obese, when they're in crowded, congregated settings. It's not a tool that everybody's going to want to use, but it's one tool that can work when we're in situations where there is high risk of transmission. So it's important to remember that there are multiple different things that we have, including vaccines, including antivirals, and masks are part of that kind of toolbox that we use. And it's especially important for high-risk people to think about that when they're in high-risk situations, like an indoor setting.
And it seems like this whole thing has just been ongoing learning about how everyone's affected. What do you think we've learned about natural immunity with all of this? Are you seeing and hearing of people who've had COVID in the past, perhaps having lighter cases or maybe being able to escape it?
Well, natural immunity holds up only so far because the virus mutates, just like other respiratory viruses. So people who are infected with one version of the variant may not have protection against infection against the other. Natural immunity does play a role, though, in protecting against serious illness. But what we know from studies is the best type of immunity is what we call hybrid immunity, immunity that comes from vaccination and natural infection. Those people tend to be the most protected. But again, this virus is going to continue to mutate forever, basically, to be able to infect us despite immunity. But what's happening is the virus is becoming less able to cause serious illness, less able to cause hospitals to go into crisis.
Okay, Dr. Adalja from Johns Hopkins, thank you so much for your time this morning.
Thanks for having me.
Stay healthy, everybody.